Do you know that every woman has ovarian cyst? You may not know you have cysts except there's a problem that causes the cysts to multiply and make them to overgrow. If today is your first time of coming across my video, you are highly welcome. Please endeavor to subscribe to my channel and click on the notification bell to get notified each time I make a new post. And also follow me on all social media platforms linked on my bio. Today we are talking about factors that can cause the overgrowth of ovarian cysts. An ovarian cyst is a sac filled with liquid or semi-sac liquid materials that arises in an ovary. Most ovarian cysts usually go away on their own. Sometimes surgery may be needed, although in rare cases. Every woman has ovarian cysts. Ovarian cyst is common to every woman that has regular menstrual periods. This is because each cyst represents a follicle of a mature egg that wants to be released by a functional ovary in each menstrual cycle. There are two main types of ovarian cysts. We have the functional cyst and the pathological cyst. The functional cyst is further divided into two, which are the follicular cyst and the corpus luteum cyst. While the pathological cyst is further divided into three, which are the dermoid cyst, cystadenoma cyst, and endometriomas. The functional cyst is the menstrual cycle related kind of cyst. Every month, your ovaries grow small molecules which help to produce the estrogen and the progesterone in order to break open for the release of an egg when you ovulate. The dermoid cyst and the cystadenoma cyst are type of the pathological cysts. They are cysts that forms in the reproductive cells and in the surface of the ovary. They can both become large and move the ovary out of its position. By so doing, it can cause a painful twist of the ovary, and this is known as ovarian torsion. Ovarian torsion is responsible for the reduction and termination of blood flow to the ovaries. Endometriomas is also a type of the pathological cyst. It is a kind of cyst that causes the cells that are similar to those inside the uterus to grow outside the uterus, and this is caused by endometriosis. The pathological cyst, which consists of the dermoid cyst, cystadenoma cyst, and endometriomas, are the bad kind of cyst, while the functional cyst that consists of the follicular cyst and the corpus luteum cyst are the good ones. Now, what are the factors that causes the overgrowth of ovarian cyst? Today we are discussing 5 different factors. 1. Hormonal imbalance. Remember I told you about functional cyst, which grows follicles, which aids in the production of progesterone and estrogen that breaks open for the release of an egg when you ovulate. When there is a hormonal imbalance, your ovary may not receive the signal that it needs to release an egg. This will cause the follicle to remain closed and positioned to continue as ovarian cysts, and by so doing, they overgrow. 2. Pregnancy. During pregnancy, some women may develop a type of a functional cyst that is known as corpus luteum. After an egg is released from the follicle, it shivers into a structure called the corpus luteum. What the corpus luteum does is to secrete hormones that will prepare the uterus for conception. The corpus luteum supports the pregnancy until the placenta is formed, which usually happens in the 12th week. After the formation have been done, the corpus luteum disappears. Some women's body systems are different, so sometimes the corpus luteum disappears in some women or in some pregnancies. And when it remains, it becomes filled with fluids and forms an ovarian cyst. But bear in mind that when it forms during pregnancy, it does not affect the pregnancy. 3. History of an ovarian cyst. If you have ovarian cysts in the past, it increases the risk of you developing more ovarian cysts. And sometimes this can be due to an ongoing hormonal imbalance. 4. PID, that is pelvic inflammatory disease. PID contributes solely to the development of ovarian cysts. This happens when bacteria from the infection spreads from the cervix to the ovaries. And when this spread is made, it causes cysts to form. Ovarian cysts that are caused by pelvic infection are usually filled with bacteria. And lastly, 5. Endometriosis. Endometriosis is a condition whereby tissues that are similar to the uterine lining grows outside the uterus. These tissues can grow inside and on your ovaries. When the endometrial tissues grows in the ovaries, it forms cavity in the ovaries that are filled with blood. These ovarian cysts are known as endometriomas, of which I mentioned earlier. Endometriosis can affect the health of your ovaries and lead to infertility. What are the symptoms of ovarian cyst? Some of the symptoms of ovarian cyst are 1. Pelvic pain, 2. Pain during intercourse, 3. Difficulty to pass out urine when there is an urge, 4. Frequent need to urinate, 5. Heavy menstrual periods, 6. Irregular menstrual periods, 7. Periods that are lighter than normal, 8. Feeling bloated with a big tummy, 9. Feeling full after eating a small meal, and 10. An unexplained weight loss. How do I prevent the development of ovarian cysts? Number 1. Always run a scan. The advisable scan to run to detect the presence of ovarian cysts are transvaginal scan and a pelvic scan. Reason why the scan is important is to ensure that if there is a change in your ovaries, it can be diagnosed early. 2. Be alert to take note of any kind of change in your menstrual cycle. Always know when you are having irregular periods or missed periods. And 3. Treat any kind of infection thoroughly so that it will not result to a PID, that is pelvic inflammatory disease. Thank you for watching and don't forget to subscribe.